Everyone, very good evening to all of you guys. Hope I'm clearly audible and visible. Please let me know in the chat box whether I'm clearly audible and visible so that we can proceed with the session, guys. And today we will be doing the session of microbiology. I know it is a very volatile subject, and you guys are very much afraid of this. So do let me know. Good evening, Veer. I know exam is approaching really soon, and you guys must be very anxious, guys. So, this is the last time you have to give your best, okay? Very good evening, Yati, Veer. I think we are live now, okay? So, in today's class, we are going to complete the subject of microbiology. We will be discussing about the most important previous year question that has been asked in your FMG examinations. We will be discussing how to solve those questions. We will be touching the most important topics, okay? Along with the question, I would be touching 4 topics, okay? All the options I would be discussing, and this is how we will be completing most of the topics, okay? And these are my Instagram and Telegram. In case if you want to connect and you are having any doubts, feel free to reach to us, right? So starting it off with the quote of the day: push yourself because no one else is going to do it for you. Okay, exam is approaching really very near. Exam is very near, so you have to be very much active nowadays. Okay, give your 100%. Whatever day you are having, just remember each and every minute of the day is very, very important. Okay, with this thing in mind, let's start with the question number one, guys. Question number one. Just give me a moment. Question number one that we are going to do. Question number one that we are going to do. Let's start with the question number one. Try to answer, guys. Which type of microscope can be used to detect the motility of the probable causative organism in a truck driver? First of all, try to understand what the question wants to know. Truck driver presenting with painless indurated genital ulcer. Okay, the truck driver is presenting with painless indurated genital ulcer after an unprotected sexual intercourse. Remember, guys, your NMC is or your NBE is very much interested in truck driver. Okay, every year there is a question. Okay, they are asking this particular question again and again. Okay, very good, guys. I can see most of you are answering. Okay, so first of all, try to tell me what is the diagnosis over here. What is the diagnosis over here? Painless genital ulcer. Your diagnosis will be syphilis. Very good. Your diagnosis will be syphilis. And what is the causative agent for syphilis? What is the causative agent, guys? Try to answer. Very good, Priya. That is your treponema pallidum. Treponema pallidum. That is the causative agent for syphilis. Okay, that is the causative agent for syphilis. It is a type of spirochete, guys. It is a type of spirochete, and spirochetes are like spiral like bacteria. Okay, so we are not able to see them very clearly. They are very thin bacteria. Okay, and for those bacteria, the question examiners wants to know what is the type of microscope we are going to use. Okay, for these bacteria, the type of microscope that we are going to use is, what would be your answer? Very good, Veer, Priya. Okay, so your answer will be dark ground microscopy. Your answer will be dark ground microscopy, guys. Okay, so answer will be dark ground microscopy. Let's see what is microbiology and what are the different things we will be studying in microbiology. So microbiology we will be discussing about the all those bacteria, all those viruses that are not visible by naked eye. Okay, so for that purpose, what we have developed some microscopes. Okay, so first microscope was given by this particular scientist, and what is the name of this particular scientist, guys? This is your Antony von Leeuwenhoek. because these viruses, bacteria can cause disease in the human being, we need to understand, right? We need to identify them and we need to treat them. Okay, so first it was given by Antony von Leeuwenhoek. Okay, this was the microscope he has discovered. This is a single lens microscope, uniocular. Okay, this one is your binocular microscope. The type of question they will ask you from this microscope is on the power of the microscope. Okay, microscope will be having this particular lens. This is the first lens, this is eyepiece. Apart from this eyepiece, these are having three more lenses. Can you appreciate? It is having three more lenses. Okay, and question has been asked on them. They will be asking what is the power of these lenses. Okay, so if they will ask you about scanner, remember guys, scanner will be having the power of 4x. Okay, if they ask you about the low power in the question, if they have written low power, then your answer will be 10x. If they have written high power, then your answer will be 40x. Your answer will be 40x. If they are asking about oil immersion field, then your answer will be 100x. Can anyone tell me what is the maximum magnification that you can get from a light microscope? Try to answer. Okay, so these are the microscope. This is your dark ground microscopy. Basically, you know what we are doing, we are staining the background black. Okay, and the organism will shine up, right? So here this is the spirochete, which is looking like a shining thing. Okay, that is the spirochete. This is known as dark ground microscopy. This is known as dark ground microscopy. Okay, apart from that, look at here, this is your electron microscope. This is your electron microscope. This is your electron microscope. Electron microscope was given by, it was given by Ernst Ruska. E for E, just remember Ernst Ruska, and it will be having lots of electrons. Okay, this is your fluorescent microscopy. All type of microscopy we are seeing, this is your fluorescent microscopy. Okay, where do we use this type of microscopy, guys? Fluorescent microscopy we are using in central institutes like AIMS. There is a lot of patients coming in, lot of patients are coming in. So what happens, you are not able to check every patient. We cannot do sputum smear for every patient. For example, the patient is coming for TB, we cannot do TB testing for every patient. So what we are doing, we are using particular dyes. Okay, these are your, for TB, what is the dye that we are using? For TB, what is the dye that we are using? Try to answer, guys. Very good. That is auramine rhodamine. Auramine rhodamine is the dye that we are using for TB. For malaria, what we are using? For malaria, what we are using, guys? That is your acridine orange. Acridine orange. Acridine orange we are using for malaria. Apart from that, for fungus, what we are using? Fungus we are using calcoflower white. Calcoflower white. So these are the important ones that you have to remember. And there is a question in your NEET PG examination that is about the phase contrast microscopy. It will be having, guys, annular ring. It will be having annular ring. Just remember what I am telling you. It will be having annular ring and the light will be using scattered light. Okay, scattered light will be there. What is the important? It will be telling us about the motility and morphology of the organism. Motility and morphology of the organisms we can identify. In fact, we can see the living cells also. Living cells can be seen via this phase contrast microscopy. We can also see the living cells. Okay, let's revise what we have studied. So what is microbiology? Microbiology, we will be discussing about the all the microorganisms. Okay, those microorganisms can be pathogen, they can be pathogen. So how do we kill pathogen? Pathogen can cause disease in the human being, right? So we need to kill them, and for killing them we need to identify them. How we can identify? With the help of microscope. The microscope was given by Antony von Leeuwenhoek. We have seen light microscope, we have seen single lens microscope, double lens microscope, we have seen dark ground microscopy, electron microscopy, fluorescent microscopy, and this one is your phase contrast microscopy. We can see different phases in phase contrast microscopy that would be telling us about the motility and morphology. Okay, try to solve question number 2. DNA transfer in bacteria via phage is known as, what do we call it? What do we call it? DNA transfer in bacteria via phage is known as. Try to rule out, guys. I'm waiting for your answers. Try to rule out. B, MDS, B, Yati, B, Priya, B. Okay, so your answer will be, what is conjugation, guys? Conjugation in bacteria, we are having different thing present on the surface of the bacteria. We are having flagella, we are having mesosomes, multiple things are there. Okay, out of them, the important one is pili. Okay, pili, the function of pili will be, pili, the function will be, it will act as a sex code. Okay, it will act as a sex code, and it is the most common method. It is the most common method of resistance transfer. Okay, so what is conjugation? That is, two bacteria are transferring their substances with the help of sex code. And what is sex code? That is your pili. In transduction, what will happen, sir? There will be some kind of bacteriophage, bache. Okay, there will be some kind of bacteriophage. In transformation, what will happen? Some naked DNA will be taken up by the cell itself, right? So your answer here will be phage. Whenever phage is included, your answer will be transduction. Okay, let me show you transduction, how it will be happening. So this is about the genetics. Okay, this is your single cell, this is your another cell. What is happening? These two bacteria are forming a sex code in between. Two bacteria are forming a sex code in between, and that is known as pili. Okay, and this is the most common method of resistance transfer in the bacteria. Okay, second one is your transformation. Remember, guys, look here. Free DNA fragments are taken up by the bacteria. This bacteria is taking up the free DNA fragment, and it will be transforming it to the other bacteria. This is known as transformation. This is known as transformation. Okay, and third one, transduction. Just remember, abduction. Abduction means what? Abduction क्या होता है? So जब भी abduction होगा, so that should be done by something, right? So what is that? Bacteriophage. Bacteriophage is what? Bacteriophage is basically a virus. Okay, it is a virus which is invading the bacteria. It is a virus which is killing the bacteria. So look here, a bacteriophage is coming. It will be taking up the substances. Okay, and it will be transferring it to the multiple another bacterias. Okay, and this is how there will be resistance to the drugs. For example, in staph aureus, we are having transduction, most common method of resistant transfer as compared to conjugation. Okay, in streptococcus pneumonia, the most common method is transformation. Okay, इसके ऊपर क्वेश्चन आता है, they will be asking you transfer in staph aureus. For example, have you studied about, सबसे पहले क्या था? staph aureus था. We have given some kind of penicillin. Okay, penicillin दिया, मर रहा था. Then what happened? We have given methicillin. Okay, then what happened? This bacteria has something, that bacteria has done something, इसके अंदर resistance आ गया, and it has become MRSA. It has become MRSA, methicillin resistant staph aureus. Now what is happening? This MRSA, इसके ऊपर हम लोगों ने दवाई दी. The drug of choice for MRSA is, try to answer, guys. What is the drug of choice that we are using in MRSA? The drug of choice that we are using is vancomycin. Okay, now what is happening? This MRSA has converted into VRSA, vancomycin resistant staph aureus. Then we will be utilizing linezolide or daptomycin. Okay, so this story is going on. This story is going on, and this is what we are doing, right? So most common method of resistance transfer, this has been asked in your examination. In staph aureus, if they are asking you, then your answer will be transduction, guys. Then your answer will be transduction. Okay, your answer will be transduction. Just a moment, guys. Okay, fine. Now try to solve this one. Sporulation occur in which phase of the bacterial growth curve? We will be solving question line wise. Okay, we will be solving question according to the topics. Okay, according to the topics we will be solving the question. Okay, audio is fine. Do let me know if audio is fine. Okay, there's some problem with the electricity. Okay, so we are having sporulation. Sporulation occurs in which phase of the bacterial growth curve? Try to answer this one. Sporulation occur in which phase of the bacterial growth curve? Stationary. MDS, very good, stranger. So that is occurring in the stationary phase. Okay, sporulation means what? They will be making spores. Okay, try to understand what is happening. What are the different phases of a bacteria that we are having? Remember guys, the first phase will be lag phase. A is first, so that would be lag phase. In lag phase, what is happening? Look here, the bacteria will be increasing in the size and the enzymatic activity of the bacteria will be increasing. In phase 2, phase 2 will be log will be second phase. Okay, in phase 2 you will be finding maximum activity, but for your examination purpose, just remember there will be increase in number of division. So if they ask you when the number of division will be more, your answer will be log phase. Okay, in stationary phase there will be sporulation, there will be toxin production, there will be antibiotic production. Along with that, one more thing is there, bacteriocin production. Okay, so you can remember the mnemonic STAB. Okay, STAB means what? You will be having sporulation, you will be having toxin production, you will be having antibiotic production, lastly you will be having bacteriocin production. Okay, so these are the important ones. Lastly, the bacteria will die. So spore formation will be occurring in, if they ask you spore formation will be occurring in, your answer will be in stationary phase. Okay, toxin production will be occurring in stationary phase. Okay, if they ask you maximum number of division will be seen in, that is your log phase. Okay, that is your log phase. Okay, so based on this, they have asked you question in your FMGE and NEET PG examination. I hope you will be able to solve this question from now onwards. Okay, the stain used for identifying cryptococcus is, what is the stain that we are using for identification of cryptococcus, guys? Try to answer this one. What are the different types of stain do we have? Try to answer this one. What are the different kind of stains do we have? We are having simple stain, guys. Let me write it for you. We are having simple stain. Simple stains means what? Simple stain का मतलब क्या होगा? We are giving a single color to all the bacteria. Okay, we are giving a single color to all the bacteria. So all bacteria will be same color. Okay, can anyone give me example? Let's revise everything. Okay, bacteriology and microbiology is a very volatile subject. You have to revise it again and again, right? So what is the stain that we are using that would be giving you a single color? For example, I am putting methylene blue. That means what will happen? All the bacteria will be stained in the same color. Okay, if I am putting basic fusion, what will happen? All the bacteria will be in the same color, right? Methylene blue will be giving you blue color, basic fusion will be giving you red color. Okay, this is your simple stain. Apart from that, you have questions from negative stain. What is negative stain, guys? What is a negative stain? Not gram staining. Negative stain will be only the background will be stained. Remember guys, in negative staining only the background will be stained. Let me explain it for you. Only background will be stained. Okay, only the background will be staining. For example, we are doing, your answer is India ink. For example, we are doing for cryptococcus, we are using like India ink stain. We are also using nigrosin guys. We are also using, apart from India ink, we are also having nigrosin. Nigrosin will do what? Only the background will be stained and the organism will shine up. Okay, next we are having is impregnation staining. You are having questions from them. Impregnation staining, what we are doing, basically we are adding something, right? What we are adding? We are adding silver. Okay, we are adding silver. And remember guys, whenever we are adding silver to something, what will happen? It will be giving black color. Okay, so we will be adding silver to thin bacteria. For example, I want to see the flagella. Okay, how I can see the flagella? I would be adding something. Okay, what are the impregnation stain that we are using? Try to answer. You already know we are having Livardity, and we are having Fontana. Okay, Livardity T we will be using for tissue, and Fontana we will be using for fluids. Okay, these are your impregnation staining. Okay, these are the three important ones that you have to remember. And lastly, you are having differential stain. Lastly, you are having differential stain. In differential, you will be studying about your all these three: Jaden staining, your acid fast staining, your Albert staining, your bipolar staining. Okay, so these are the differential stain. Differential, it will be differentiating between two bacteria. Okay, so we are having simple, we are having negative, we are having impregnation staining. For example, I want to see flagella. I want to see flagella. Flagella is a very thin structure. So what I will do, I will add some silver over flagella. What will happen? That flagella will be visible now. Which color it will be giving? It will be giving, sir, black color. Why? Because I have added what? I have added silver. Silver कौन सा color देगा? Silver will be giving black color. Okay, silver will be giving black color. I will be telling you about McConkey and all. Just wait. Okay. Next, try to solve this question. A 3-year-old child present with fever. The patient is having symptom. Nowadays they are not asking question directly, they are asking question based on the history. Okay, इस तरीके के question आते हैं. So the patient is having fever, patient is having loose stool, and patient is having blood in the stool. Okay, try to identify the keywords. Okay, which enrichment medium is used to isolate the organism from the stool sample? कैसे इसको isolate करेंगे? How we will be isolating this particular bacteria? Try to answer. First one we are having is Robertson cooked meat. Is it what is the diagnosis, guys? Try to answer. What is the diagnosis? What you are thinking? What could be the diagnosis? Selenite. Everyone is telling selenite. So that is your dysentery. This is the example of dysentery, and dysentery is due to Shigella and Salmonella. Okay, dysentery is because of Shigella, and the stain that we are, the thing that we are using, the enrichment media, that is your selenite F broth. Selenite F broth we are using for Shigella and Salmonella. Dysentery is what? Dysentery is basically blood in the stool, right? That is the dysentery. RCM we are using for what? If you want to eliminate option, if you don't know the answer, you will be eliminating option. So how you can eliminate those options? Try to look here. RCM we will be using for tetany, Clostridium. We will be using it for Clostridium. It can be used for tetany. Tetany will be causing what? Clostridium tetany will be causing what? It will be causing tetanus. Okay, tetanus, we will not have bloody diarrhea. Second, Clostridium perfringens is important one. That would be causing what? Food poisoning or something else, right? Food poisoning. So that cannot be the answer. Alkaline peptone water, we will be using it for Vibrio, guys. Alkaline peptone water we will be using for Vibrio. We will be using for Vibrio. In Vibrio, can anyone tell me what kind of diarrhea you will be finding? In Vibrio, what kind of diarrhea you will be finding? Just a moment, guys. In Vibrio, what is the diarrhea that you will be finding? In the stool, what is the specific thing that you will find? That is your rice watery stool. Rice watery stool is a feature of rice watery stool. They will be asking you in the examination. That is your rice watery stool. Just give me a moment, guys. I think there's some problem with the connection. Let me Okay, fine guys. So now try to answer this one. So that would be your rice watery stool. Rice watery stool is a feature of Vibrio cholera. Vibrio cholera. One more question they are asking from this Vibrio cholera, that is, it will be binding to which receptor? That question is coming from physiology as well as from your microbiology. It will be binding to your GM1 ganglioside. It will be binding to your which receptor? The receptors will be present in your GM1 ganglioside. Okay, GM1 ganglioside. Brain and heart infusion we will be using for acid fast and non-acid fast organisms. Okay, generally aerobic or organisms we will be using it. Okay, so your answer here will be C. Okay, answer here will be C. Okay, try to see what are the different types of medias that we are having and trying to answer. Okay, so we will be revising quickly. We are having simple medias. Sir, what is the difference between a simple media and a complex media? Simple media, acid fast organisms cannot grow. Acid fast cannot grow. Okay, simple media, the example will be nutrient agar, nutrient broth. Broth का मतलब क्या होता है? Broth मतलब soup, right? And third one is your Muller Hinton agar. Then we are having complex media. Complex media, what will happen? Every organisms can grow here. Enriched and enrichment, every organisms can grow here. Just remember, enriched means what will happen? It is a solid. Just remember D for D, it is a solid media, and enrichment will be a liquid media. Every organisms can grow here. Okay, so blood agar, what are we using in the blood agar? Important point that we have to see, we are using 5% sheep blood. All these things are question that I'm telling you. Okay, chocolate agar is the favorite of Haemophilus influenza. The single word that you have to remember about it. Okay, LSS we are using it for Loeffler's serum slope. Okay, what is the another name for diphtheria? Diphtheria is Clab Loeffler's bacilli. Okay, so that we are using for diphtheria, Corynebacterium diphtheria, that is Loeffler's serum slope. Okay, PPL or agar that we are using for mycoplasma paplo, that is mycoplasma, छोटा सा organism mycoplasma. क्या नहीं होता माइकोप्लाज्मा के अंदर? सेल वॉल नहीं होता. ओके, बॉडेड गेंगू वी आर यूजिंग फॉर pertussis. We are using borded gengu for pertussis. Okay, borded gengu regan louis we are using for pertussis. Okay, enrichment, selenite f broth is the media we are using for both the sisters. Okay, just remember, दो बहनें हैं, पहले का नाम है शिगेला, दूसरी का नाम है बच्चों साल्मोनेला. ओके, शिगेला साल्मोनेला, both are sister. घी किसको पसंद है? Who is loving the ghee? Ghee broth is for Yersinia pestis. Okay, that would be causing your प्लैग. यर्सीनिया की वजह से क्या होता है? प्लैग होता है. ठीक है, नेक्स्ट वन EMGH इज फॉर लेप्टोस्पायरा. सारा एक जगह याद रख लो, EMGH इज फॉर द लेप्टोस्पायरा. RCM we are using for Clostridium species. Okay, Robertson cooked meat media. Alkaline peptone water we have already seen, that is for the Vibrio cholera. Okay, Vibrio cholera, yes, Pablo is the mycoplasma. Okay, next selective media. Selective media, what will happen? We will be having only few organisms will grow. Okay, selective मतलब क्या हो गया? सिर्फ कुछ ही लोग grow कर पाएंगे. That is your selective media. We are having LJ media. LJ media we are using for what? Lowenstein Jensen media we are using for tuberculosis. Okay, and LSS we are using for again diphtheria. Okay, again we are using for diphtheria. Next, selective indicator differential media, only single organism will grow here. We are having McConkey agar, we are having clad. Okay, which one is better? McConkey is better or clad is better? Next, we are having transport media. VR media is for the Vibrio cholera. Carry Blair is also for the Vibrio cholera. Sex media is for Salmonella and Shigella. Salmonella and Shigella. ट्रांसपोर्ट मीडिया क्या होते हैं बच्चों? ट्रांसपोर्ट मीडिया वो होता है जिसके अंदर हम बैक्टीरियाज को ट्रांसपोर्ट करते हैं. पाइक्स मीडिया इज फॉर द पायोजीन्स. ओके, एंड स्टुअर्ट एंड अमाइस वी आर यूजिंग फॉर गोनो एंड मेनिंगोकोकाई. वी आर यूजिंग इट फॉर गोनोकोकाई एंड मेनिंगोकोकाई. ओके, नेक्स्ट वी आर हैविंग इज different culture medias. सारे एक जगह पे लिखते हैं. All the culture medias are here itself, right? So try to learn and try to remember. Okay, very good MDS. That is your clad is better. Okay, clad is better. Look here, Staph aureus. What is the culture media for Staph aureus? That is mannitol salt agar or Ludlam's media. Okay, Ludlam's media or mannitol salt agar. Okay, speak with me wherever you are so you can remember. Okay, second one, for pyogenes we are having crystal violet blood agar, that is CVBA. CVBA is for pyogenes. Okay, enterococcus, that is your bile esculin agar. Neisseria, that is Thayer Martin's media. Okay, Neisseria Thayer Martin media. Try to answer this one. For MTB, what is the media that we are using? Right now we have just discussed, that is your LJ media, Lowenstein Jensen media. Okay, Bacillus anthracis के लिए कौन सा मीडिया यूज में लेते हैं? That is your प्लेट. That is your plate. I would be telling you the mnemonics. Okay, Clostridium में we have already seen, that is your Robertson cooked meat media. Diphtheria you have already seen, that is LSS. Nocardia we are using a technique that is known as paraffin bed technique. Paraffin bed technique. Okay, लिस्टीरिया के लिए कौन सा यूज में लेते हैं? ट्राई टू आंसर टिल देन. इकोलाई के लिए वी आर यूजिंग क्लैट. इकोलाई की वजह से कौन सा इन्फेक्शन होता है? यूटीआई होता है, स्ट्रोम्बोइड फिश पॉइजनिंग होता है, फॉर्नस गैंग्रीन होता है, राइट? सो फॉर दैट पर्पज वी आर यूजिंग क्लैट बिकॉज क्लैट इज बेटर. ओके, वी कैन ऑल्सो यूज EMB ऑल्सो, दैट इज ईओसिन मिथिलीन ब्लू. शिगेला एंड साल्मोनेला, दैट इज योर selenite F broth. We are using what? Selenite F broth. Selenite F broth. Okay, for listeria, try to answer for listeria what we are using. Till then, Pseudomonas. Pseudomonas is a bacteria, but it is growing in the antiseptic environment, that is known as Saccharomyces agar. That is known as Saccharomyces agar, bachcho. Okay, Legionella, we will be using BCA. Okay, buffer charcoal yeast extract. Okay, buffer charcoal yeast extract. And Bordetella pertussis we are using Bordet gangu. Okay, that is the media that we are using is Bordet gangu. For Leptospira we are having EMJH. For Mycoplasma we are having Eton media. For Borrelia we are having Kelly's media. For Trypanosoma we are having N media. And lastly we are having Campylobacter, and the media is Schiromedia. Okay, video is not working off. Just a moment, guys. There is some problem with the camera. It will be corrected in like few minutes. Wait for it, guys. Okay, till then try to answer this one. Okay, till then try to answer this one. Which of the following method is used to sterilize a glass petri dish? Okay, कैसे हम लोग glass petri dish को sterilize करेंगे? What is the method that we will be using? And from this particular topic, guys, this is a वेरी इंपॉर्टेंट टॉपिक. मल्टीपल क्वेश्चंस आर बीइंग आस्क्ड. ओके, तो स्टरलाइजेशन में से बहुत सारे क्वेश्चन आ रहे हैं. यू हैव टू रिमेंबर दिस. ओके, सो ट्राई टू आंसर दिस वन व्हाट वी विल बी यूजिंग टिल देन. ओके, प्रिया saying B, MDS, aspirant, strangers. Try to answer, guys. So we will be using, look here, we will be using hot air oven. Okay, I would be telling you about the important things about all these sterilization. Okay, basically this sterilization is divided into two part. It will be having physical method, we will be having chemical method. In physical we are using heat can be dry heat or moist heat. Moist heat means they will be using what? Steam. Okay, dry heat means we will be having this your dry heat will be having hot air oven. Okay, dry heat will be having hot air oven. So what is the important thing you have to remember about this hot air oven? We can use it for like syringes, all the syringes. We can use it for swabs. We can use it for all the glasswares like we are having in the question. They have given you the petri dish. Your answer will be hot air oven. Two important things you have to remember. What is the control we are using here? That is your Bacillus subtilis spores. कंट्रोल का मतलब क्या होता है? कंट्रोल मतलब क्या होता है? बेसिकली हम लोग हमारे जो इंस्ट्रूमेंट्स हैं उनके साथ में क्या डाल देते हैं? ये बैक्टीरिया डाल देते हैं. अगर ये बैक्टीरिया मर गया इसका मतलब क्या है कि हमारा इंस्ट्रूमेंट भी स्टरलाइज हो गया, दैट इज द कंट्रोल. सो व्हाट इज द थिंग दैट वी आर यूजिंग Bacillus subtilis spores. Okay, what is the temperature that we are using it for 160 degree for 2 hours. That is all about the hot air oven you need to remember. Incineration क्या होता है, ये मशीनें होती है हॉस्पिटल्स के पास में, and the temperature that we are using over here is too much temperature, that is 1200 degree Celsius to 1200 degree Celsius, and they are utilized for हॉस्पिटल वेस्ट. ओके, हॉस्पिटल वेस्ट में एनाटॉमिकल वेस्ट हो गया आपका, बेडिंग्स हो गए, ऑल दिस थिंग्स विल बी गोइंग इनसाइड दिस इंसिनरेटर. इट इज अ वेरी बिग मशीन. ओके, इट इज अ वेरी बिग मशीन. Next we are having is your moist heat. Moist heat we can use on, we can divide it on the basis of temperature. If it is less than 100 degree, if it is 100 degree, or if it is more than 100 degree. Okay, so less than 100 degree we will be using two things. We will be using two things. We are having what? Pasteurization. We are having inspisation. Okay, pasteurization was given by, try to answer, pasteurization was given by, we are using pasteurization for milk, right? Pasteurization we are using two method. One is known as Holder's method. For milk we are using Holder's method, and we are using flash method. Holders mein what we will be doing, we are holding the temperature 63 degrees Celsius for 30 minutes. That is your Holders method. Flash में क्या करेंगे, थोड़ा गर्म करेंगे 72 डिग्री सेल्सियस पे 20 सेकेंड तक, and then we will be dropping the temperature to 13 degrees Celsius. Okay, this is your pasteurization. Two methods of pasteurization we are having, and pasteurization was given by Sir Louis Pasteur. Okay, next one is about the inspisation, guys. Inspisation, we will be doing inspisation for two medias. These are your LJ media and LSS media. LJ matlab Lowenstein Jensen, and LSS matlab Loeffler serum slope. Okay, then we will be having 100 degrees Celsius. We can do boiling, that is your boiling something at 100 degrees Celsius, but this one will not kill the spores. For spores killing, what we can do, we can do tyndallization. Tyndallization से याद रखो 3 दिन तक कुछ कुछ करना है. Tyndallization, that is your, we will be giving temperature, that is your 100 degrees Celsius for 20 minutes into 3 days. For 3 consecutive days we will be heating the thing for 20 minutes. That would be tyndallization. Okay, lastly the most important that we are having is your autoclaving. The temperature that we are using for autoclaving is 121 degrees Celsius, and the psi is 15 psi, and time will be 15 minutes. Autoclave, I think you must have seen, there are multiple types of autoclave we are having, right? किसके लिए करेंगे ऑटोक्लेविंग? ऑटोक्लेविंग वी आर डूइंग फॉर ऑल द इंस्ट्रूमेंट्स, surgical instruments we are putting in autoclaving. Okay, apart from that we will be doing it for culture medias. You will be finding autoclave in your laboratory. We will be doing it for culture medias and for your sutures. Exceptions you have to remember, because they are most commonly asked. Which is the media we are not going to do autoclaving? कौन से मीडिया का नहीं करेंगे? जिनका हमने इंस्पिसेशन कर लिया, दैट इज योर LJ मीडिया एंड LSS मीडिया. दिस इज द क्वेश्चन दे हैव आस्क्ड यू. फर्स्ट क्वेश्चन. सेकेंड थिंग, कौन से सूचर्स है जिनको हम लोग autoclave नहीं करेंगे? These are your catgut sutures. Catgut sutures are basically coming from the gut of cat or not? Try to answer from where we are getting catgut sutures. They are not coming from the gut of cat, but from where we are getting this. Okay, so this is about the heat. Okay, then we are having filtration. In filtration we are having small size of filters, air filters. We are having like seeds, HEPA. We are having ultra low particulate airway filters. Okay, ULPA. So we are having these things. Okay, next we are having is radiation. For radiation we are having two things. We are having ionizing radiation, we are having non-ionizing radiation. Ionizing radiation we are using it for catgut sutures. Okay, catgut sutures. सारे सूचर के लिए हम लोग क्या करेंगे? ऑटोक्लेविंग करेंगे. बट कैटगट सूचर वी कैन नॉट डू ऑटोक्लेविंग, सो वी विल बी यूजिंग आयनाइजिंग रेडिएशंस लाइक एक्स-रे एंड गामा रेज. ओके, for non-ionizing we are using it for OT fumigation. Okay, and control here will be Bacillus pumilus. Okay, Bacillus pumilus will be the control for radiation. Here for filtration, that is your Brevendimunas dimunata. Okay, lastly, we are having chemicals that you have to remember. The control for chemical will be Bacillus globogi. Bacillus globogi. कंट्रोल विल बी बेसिलस ग्लोबोजी. ये इतना ही याद रखना है, इतना तो याद रखना ही रखना है. ठीक है. नेक्स्ट वी आर हैविंग एल्कोहल. एल्कोहल वी आर यूजिंग फॉर, एल्कोहल मतलब क्या हो गया, दैट इज योर स्पिरिट. वी आर यूजिंग स्पिरिट फॉर योर स्टेथोस्कोप, योर थर्मोमीटर. वी आर यूजिंग स्पिरिट फॉर योर स्टेथोस्कोप एंड योर thermometer. Stethoscope and thermometer. For aldehyde, just remember 2% glutaraldehyde, that is known as Sidex. For all other scopes we are using this particular thing. Okay, other scopes, laryngoscope, other all scopes, we are using 2% glutaraldehyde, that is known as Sidex. Sidex नाम से मिलेगा मार्केट में. Next we are having is phenol like Dettol and Lysol. And lastly we are having halogen. Halogen will be including your iodine, betadine, and your most important, the question that has been asked is sodium hypochlorite. Sodium hypochlorite. Okay, sodium hypochlorite. These are the important ones. Just look at it once. Till then I'm just fixing the camera for a minute. Okay. Okay. Try to solve this question. In which of the following is the disk diffusion method for antibiotic susceptibility testing is applied? Try to answer this one. In which of the following method disk diffusion method for antibiotic susceptibility testing is applied? What is antibiotic susceptibility testing? Remember guys, we are using a test that is known as Kirby-Boyer disk diffusion test. Let me teach you what it is. This is your antibiotics susceptibility testing. Okay, AST. So what we are doing culture. Okay, for example, you are having some kind of infection in the body. What you will do, you will give the sample, right? In that sample, what the microbiologist will do, they will just try to grow that sample. Okay, उसको grow करेंगे. कौन से अगार के अंदर ग्रो करेंगे? व्हाट इज द अगार दैट दे विल बी यूजिंग? दैट इज नॉन एज मुलर हिंटन अगार. जो अगार यूज में लेंगे उसको बोलेंगे मुलर हिंटन अगार. दिस इज योर मुलर हिंटन अगार. And in that Muller Hinton agar, what is happening, whatever organism is there in your sample, that is growing. Now what they are doing, they are putting some antibiotics. Okay, for example, this is antibiotic, this is another antibiotic, this is another antibiotic. They are putting multiple antibiotics over here, and they will be identifying that which one is working fine. Look here, this antibiotic is working very fine. What is happening, it will be giving a zone of inhibition. Because of this antibiotic, what is happening, the bacteria is not able to grow over here, right? So this antibiotic is susceptible. This antibiotic is susceptible. For example, I am talking about like urine infection. Okay, and the patient is having some kind of UTI. Okay, you are sending the sample, and this is the sample, and this is, for example, the drug. For example, this is your Norflox, right? Now what is happening, Norflox is susceptible, but this is your nitrofurantoin. Let's say this is your nitrofurantoin, another drug. This is not working on this particular bacteria. This is not working, right? So they will be giving you a report after 3 days. After 3 days they will be telling you that particular drug is susceptible and this drug is resistant. This is known as antibiotic sensitivity testing, and this is done on which agar, Muller Hinton agar, and the method is known as Kirby Boyer. Just remember, Kirby Boyer disk diffusion test. This is known as Kirby Boyer disk diffusion testing. This is known as Kirby Boyer disk diffusion testing. Okay, so this is the important thing that you have to remember. Okay, KBDDT. Okay, so your answer will be Kirby Boyer disk diffusion testing. Okay, now you understand. Okay, try to answer this one. An elderly male patient presented with the symptoms of meningitis, and the CSF sample was subjected to gram staining. Okay, and microscopy was shown in the given image. Which of the following will be the characteristic of this particular likely organism? Okay, so you have to identify the keyword, and this is the exact question that is coming in your examination. Okay, from your exam, this is the previous year question, right? So what was that? They have given you, there is an elderly male patient. First of all, try to identify, try to give me the diagnosis. What can be the diagnosis? Okay, this is an elderly male with the symptoms of meningitis. Okay, symptoms of meningitis. Yahan par what we have done, we have done the lumbar puncture, we have taken the sample. Okay, you will be having Kernick positive, Brudzinski positive, the patient will be having projectile vomiting. All these things they will be giving you in the question itself. Patient is having fever, all those things. Okay, now what is happening? Now we are doing the gram staining of this particular thing, and in the microscopy what you can observe over here, try to see what is that, what is the kind of stain that they are using. Can you see, are they cocci or are they bacilli? First of all, try to identify, are they cocci? Cocci are round bacteria, bacilli are rod like bacteria. Okay, so is it a bacilli or is it a cocci? Okay, you can see it is a bacilli, it is a bacilli. Okay, it is a bacilli, first thing. And second thing, in elderly patient, the common cause for meningitis can be two. Either it can be due to streptococcus agalacti, that is group B streptococci, or either it can be due to listeria, guys. Listeria. Okay, so listeria, you have to remember, agalacti cannot be the answer because agalacti is a cocci. It will be streptococcus will be in the chains. Okay, streptococcus कैसे होते हैं, chains के अंदर रहेंगे. So this is a gram positive cocci. Okay, and this one is gram negative bacilli. This one is gram positive bacilli. This one is gram positive bacilli. Okay, so you can easily identify that this is the shape of the bacteria. And second thing, even if you remember the motility, okay, even if you remember the motility, listeria will be showing you differential motility. And this was the question they have asked you in a NEET PG examination, है ना? तो कौन सी मोटिलिटी दिखाता है? इट विल बी शोइंग यू डिफरेंशियल मोटिलिटी. ओके, व्हाट आर द अगार दैट वी हैव यूज्ड? अभी पढ़ा था, वी आर यूजिंग पालकम अगार. ओके, पालकम अगार. So this one will be showing you differential motility. What is differential motility? For example, ये मोटाइल होगा 22 डिग्री सेल्सियस पे और नॉन मोटाइल होगा 37 डिग्री सेल्सियस पे. सो व्हेन वी आर यंग, जस्ट रिमेंबर लाइक दैट. जब हम लोग यंग होते हैं, व्हाट वी डू, वी विल ड्रिंक एंड वी विल रोम ऑल अराउंड, राइट? सो दैट इज योर at the young age. But when you attain a specific age, you will be having like maturity, right? So after 37 क्या होता है, घर पे बैठ के लेते हैं, ऐसे याद रखो, ठीक है? तो this is your differential motility. Okay, now let's see what are the different types of motility we are having. So first one, tumbling motility is seen with listeria. Just remember, listeria, the patient will be tumbling, the motility will be tumbling. tumble करना मतलब क्या होता है? टंबल कौन करते हैं? जो शराबी लोग होते हैं. दोज पीपल हु आर शराबी लोग विल बी डूइंग टम्बलिंग. जस्ट रिमेंबर, लिस्ट्रीन इज जस्ट लाइक एल्कोहल, सो लिस्टीरिया विल बी टम्बलिंग मोटिलिटी. Darting motility you will be finding with Vibrio cholera and Campylobacter jejuni. We are having VCD, the mnemonic, right? VCD होते थे पहले. So that would be your darting motility. Okay, swarming, we will be seeing swarming with the Proteus. ये देखो, लुक हियर, दिस इज द स्वार्मिंग मोटिलिटी. ओके, स्वार्मिंग का मतलब क्या होता है? छा जाना. ओके, नेक्स्ट वन वी आर हैविंग फॉलिंग लीफ. लाइक फॉलिंग लीफ मतलब पत्ता गिरा दिया, दैट इज योर जियार्डिया. इट विल बी हैविंग हाउ मेनी पेयर्स ऑफ फ्लैजेला? इट विल बी हैविंग 4 pairs of flagella. Okay, next we are having is your corkscrew motility. We will be seeing in Trypanosoma pallidum because it is a spirochete. And lashing motility we will be seeing in Borrelia and Leptospira. लाश को कैसे रखोगे? लपेट के. लाश को रखोगे बोरे में लपेट के. So that would be seen in Borrelia and Leptospira. Just remember like that. I know these are absurd thing, you have to remember. But T4 twitching, T4 Trichomonas vaginalis will be having 5 flagella will be there. Okay, that is your Trichomonas vaginalis. कौन सा vagina मिलता है इसके अंदर? We will be having strawberry vagina, also known as Colpitis macularis. Okay, रोटेटरी मोटिलिटी यू विल बी सीइंग इन बेलेंटीडियम कोलाई. ओके, रोटी कैसे बनाते हो, रोटी बनाते हो बेलन से, यू कैन रिमेंबर लाइक दैट, दैट वुड बी योर बेलेंटीडियम कोलाई. ठीक है, दैट वुड बी योर बेलेंटीडियम कोलाई. ओके, स्लो फॉर्म ऑफ स्वार्मिंग दैट इज नॉन एज स्टेटली, धीरे धीरे जो होता है उसको बोलते हैं स्टेटली, दैट इज सीन विद क्लॉस्ट्रिडियम. ओके, एंड लास्टली द क्वेश्चन दैट इज योर डिफरेंशियल मोटिलिटी इज सीन विद लिस्टीरिया. लिस्टीरिया 22 to 25 डिग्री विल बी मोटाइल. इस यंग एज में ये मोटाइल होगा. आफ्टर दैट व्हाट विल हैपन, इट विल बिकम नॉन मोटाइल, इट विल बिकम नॉन मोटाइल. सो दिस इज द डिफरेंशियल मोटिलिटी. क्लियर है बच्चों? सो योर आंसर विल बी listeria. This is the listeria infection. Okay, now try to solve this one. A patient presented with complaints of fever for last 3 days. The patient is having what? Patient is having fever from last 3 days. Okay, patient is also having some kind of general fatigue. Echocardiography telling us about the vegetation. That means whenever you will study about any kind of valvular disease, वॉल्व की बात होगी, एंडोकार्डियम की बात होगी, दैट इज योर नथिंग बट योर एंडोकार्डाइटिस. ओके, whenever you will discuss about valves. Okay, so there is some vegetation on the valves, and what is happening, on blood culture was done, the organism was cultured, and it is showing what, which kind of hemolysis, alpha hemolysis on blood agar, and was resistant to optochin and bile. Which of the following bacteria is most commonly implicated in this particular situation? Try to answer, guys. So that is your mycoplasma. Remember guys, mycoplasma, optochin, bile we have not seen. In mycoplasma what we have seen? We have seen the poplar agar, we have seen the ketone, right? But this one, Streptococcus viridans can cause a disease that is known as SABE. What is SABE? Subacute bacterial endocarditis. Okay, so let's see how streptococcus is getting divided. Okay, so streptococcus की थोड़ी सी कहानी पढ़ लेते हैं. Streptococcus are seen in the chains. Okay, ये कैसे दिखेंगे? chains में मिलेंगे. These are the cocci. These are the cocci. Okay, staph aureus के बारे में क्या याद रखना है? staph का मतलब होता है cluster, aureus का मतलब होता है gold. Okay, aureus मतलब au मतलब gold, so that would be golden color colony with the clusters. Okay, that is your staph aureus. So it will be showing hemolysis. Okay, beta hemolysis, alpha hemolysis, gamma hemolysis. It will be showing you 3 types of hemolysis. Beta is complete hemolysis. Can you see? Beta is complete hemolysis, alpha is partial, and gamma is no hemolysis. Okay, on the basis of this particular thing, this streptococcus is divided into 3 classes. Very very important guys. Strepto and staph, multiple times question asked. Okay, so we are having alpha streptococci, we are having beta, we are having gamma. How they are divided? On the basis of this blood, this hemolysis. Okay, on the basis of hemolysis, right? Now alpha will be having one more thing, that is a antibiotic. We are putting an antibiotic. Optochin मतलब क्या है? Optochin is an antibiotic. If it is killed by optochin, that is optochin positive. If it is negative, if it is optochin positive, what will happen? That bacteria is your streptococcus pneumonia. That bacteria is your streptococcus pneumonia, also known as pneumococcus. What are the important things that you have to remember? These are lens shaped bacteria and they are diplococci. That means they will be found in the pairs. Okay, on chocolate agar you will be finding specific appearance that is known as Droughtman's colony and Quorum coin appearance. Okay, pneumococcus is a capsulated bacteria that would be giving you a reaction that is known as Q-lung reaction. Macfadden कहाँ पर मिलती है? Macfadden reaction where do you find? Okay, and it is the most common cause for 2 things. First is typical pneumonia. Typical pneumonia, the most common cause will be pneumococcus. Second, any kind of meningitis, the most common cause will be pneumococcus. Normal meningitis, not talking about neonatal but normal meningitis, the answer will be pneumococcus बच्चों. ठीक है, Streptococcus viridans, that would be causing subacute bacterial endocarditis. Okay, subacute bacterial endocarditis. Endocarditis means there is problem with the valve itself. Okay, then we are having Streptococcus mutans, that would be causing म्यूटेंस विल बी कॉजिंग, मुंह के अंदर क्या कराएगा? ये डेंटल कैरीज कराएगा, राइट? सो फर्स्ट वन वी हैव ऑलरेडी डिस्कस, दैट इज optochin sensitive, optochin resistant. Second, beta is further divided on the basis of bacitracin or PYR. Just remember, pyo are B positive, Just remember pyo are B positive and PR positive, PYR positive. You can remember like that. So pyogens are B positive, PYR positive, whereas agalacti is B negative and PYR negative. So what are the diseases you are having from Streptococcus pyogens, also known as group A streptococci? You are having suppurative complications, you are having non-suppurative complication. Suppurative may you will be having impetigo. This is your impetigo, bullous impetigo, non-bullous impetigo. Try to answer. Very good, MDS. That is McFadden reaction will be seen with Bacillus anthracis. Okay, impetigo, you are seeing a honey colored crusting here. This is your non-bullous impetigo. Okay, Quincy is what? Quincy is basically paratonsillar. Para मतलब क्या होता है? Near the tonsil. So that would be giving you near the tonsil abscess. That is a paratonsillar abscess. Scarlet fever is also a suppurative complication of Streptococcus pyogenes. Non-suppurative may we are having acute rheumatic fever. We are also having acute glomerulonephritis. This is your Quincy. This is your Quincy. This is your paratonsillar abscess. ENT में पढ़ोगे क्विंकेस डिजीज, दैट इज अ डिफरेंट एंटिटी. वहां पर क्या होगा? यूवुला में कुछ होगा. ठीक है. सो हियर दीज टू थिंग्स आर क्लियर, राइट? Look here, group B streptococci, they are B positive and PR negative. B positive and PYR negative. They are basically CAMP positive. Okay, CAMP positive and HHT positive. Just remember this information that I am giving you. Okay, so agalacti is the most common cause of neonatal meningitis. Okay, neonatal meningitis, most common cause will be Streptococcus agalacti, group B streptococci. They are CAMP positive. This is the CAMP test. This is group B streptococci. This is Staph aureus. They will be showing you this type of appearance. This is known as CAM test. CAM is basically Christie Atkins Monk Peterson. They are the name of scientist. Okay, so these are the beta. Okay, now we will be discussing about the gamma. Gamma hemolysis is shown by enterococcus. The important lines that you have to remember from this, it is a spectacle shaped bacteria. Second, you have to remember 6.5% of NaCl and bile. It can grow in that also. Okay, this one will be giving you which color? Black color on bile acetylene agar. Okay, we have already discussed that. And this one will be causing left-sided endocarditis in the patient who are having what? IV drugs. Okay, IV drug abusers. And it will be having, we are also having vancomycin resistant enterococci, and this is due to a gene that is known as VAN gene. That is due to VAN gene. Okay, so it will be looking like this. Okay, this is your spectacle shaped bacteria. Okay, so this is all the story of the streptococcus. In a single page you are having the complete story of streptococcus. Okay, lens, if they ask you lens shaped bacteria, then your answer will be streptococcus pneumonia or pneumococcus. Okay, if they ask you spectacle shape, then your answer will be enterococcus. कर लोगे ये question? Here the answer will be, because it was resistant to optochin, it was resistant to bile, that would be your streptococcus viridans. Streptococcus viridans is resistant to optochin and resistant to bile also. Okay, so this is how you will be answering. Okay, try to solve this one. A patient has complaints of fever with a mild headache associated with some difficulty in swallowing. Okay, a throat examination reveals swollen glands, a thick whitish membrane over the tonsils which bleeds on scraping the lesion. Okay, वो एक membrane है, उसको हटाने पे there will be pain. A sample is taken from the exudate and a gram stain is done. Which of the following is shown is the organism? Try to identify the organism. What is this organism out of these four? We are saying C, that is diphtheria. Is it diphtheria? How you can see it is diphtheria? Guys, you can see, can you appreciate this Chinese letter appearance? This is your Chinese letter appearance. Chinese letter appearance. Chinese letter appearance you will be finding in which bacteria? You will be finding this particular thing in diphtheria. Molluscum contagiosum, what you will be finding? Pearly white umbilicated nodules, that is molluscum contagiosum. Bacillus anthracis we will be discussing now, McFadden's reaction, all those things. Okay, so this is your Corynebacterium diphtheria. And lastly we are having beta hemolytic streptococci. That cannot be the answer. We are not seeing any kind of cocci over here. Cocci मतलब क्या होता है? Round bacteria. So there is no round bacteria. So this cannot be the answer. So answer here will be C. Answer here will be C. Very good, guys. And these granules, can you guys tell me? These granules are known as These are known as, this is also a question, these are known as metachromatic granules. What are the other name for these granules? These are known as metachromatic granules. These are also known as Babes Ernst granules. These are also known as Volutin granules. These are also known as polymetaphosphate granules. Okay, Babes Ernst, Volutin, and polymetaphosphate. Okay, what are the stains that you can use for diphtheria? What are the stains that you can use? Try to answer. We can use plant. We can use ponders. Let's revise here itself. We can use ponders. We can use Loefflers. Loefflers is the best one. We can use Albert. We can also use, guys, Neisers. We can also use Neisers. So these are the stains that we can use for Corynebacterium diphtheria. Corynebacterium diphtheria. Where do you find this type of pseudomembrane? Pseudomembrane की most common location क्या होती है? Pseudomembrane, the most common location will be near the fossil, and one thing you also find, that is cervical lymphadenopathy, that is known as bull neck. I am just giving you the clinical important points that they will be asking you. Okay, so is it a toxemia or is it a bacteremia? Is it a toxemia or is it a bacteremia? Remember, guys, diphtheria is a toxemia. Whenever we are having toxemia, what we can do, we can give anti-diphtheric serum. We can give anti-diphtheric serum, and doses will be 80,000 to 1,20,000. Okay, we are also having some known pathogenic bacteria like Corynebacterium minutissimum. This is the question. Minutissimum. What it will be causing? It will be causing what? It will be causing erythrasma, bachcho. Erythrasma. And what is the color you will be finding? You will be finding under wood lamp examination, that is your coral red fluorescence. Okay, coral red fluorescence. Okay, every diphtheria is not pathogenic. Okay, they are made pathogenic with the help of a gene that is known as tox gene. Basically what we have studied about, like transduction. Okay, so this is known as transduction. Because of transduction, what is happening? Lysogenic conversion is happening, and non-pathogenic bacteria is converting into a pathogenic bacteria. Okay, what are the complications that we have to remember here? किसकी वजह से बच्चा मरता है? The complication that we are having is myocarditis. Complication that we are having is myocarditis. We are also having like zecum. We are also having parvum. All those things. These are your MDR isolate. Okay, and immunomodulator species. Okay, try to solve this one. Which pathogen causes attachment and effacement lesion in the intestinal mucosa as shown below? What is this? A and E lesions are shown with which bacteria out of this? All of them are having what? E. coli. So out of which strain of E. coli will be causing this? Try to answer. Till then, let me tell you what are the most common diseases that are caused by E. coli. What are the most common diseases that are caused by E. coli? E. coli, the most common cause of UTI. E. coli is the most common cause of UTI. If they ask you the gram-positive organism that is causing UTI, try to answer in the chat box, guys. Okay, then it will be causing diarrhea. Apart from that, there is a question they have asked you in your examination, that is your scromboid fish poisoning. Scromboid fish poisoning is due to E. coli. Okay, it is coming from Enterobacteriaceae family, that is gram-negative, right? Next we are having, it will be causing Foreigner's gangrene. Okay, so try to answer this one. Attachment and effacement type of lesions are seen with which type of E. coli? A and E lesion. Very important question, guys. Just remember, we are having 5 types of enteropathogenic. We are having enteroinvasive. We are having toxigenic. We are having hemorrhagic. We are having aggregative. Okay, so we are having EPEC, that is enteropathogenic E. coli. We are having enteroinvasive E. coli. We are also having enterotoxigenic E. coli. We are having enterohemorrhagic. And lastly we are having enteroaggregative. Okay, so what are the important causes? What are the important diseases? Let's discuss. Pathogenic, just remember P for pathogenic, it will be causing diarrhea in pediatric age group patients. Okay, in those pediatric age group patient, you will be finding attachment and effacement type lesions. Okay, so your answer will be here enteropathogenic. Okay, very good Nidhi, very good MDS. So your answer here will be enteropathogenic. Okay, next one is your entero-invasive. Invasive means what? It is going into your blood vessel, right? When it will be going to your blood vessel, it will be causing symptoms like shigellosis. Okay, it will be causing symptoms like shigellosis. Enterotoxigenic, just remember T for toxigenic, it will be causing which diarrhea? That is known as traveler's diarrhea. Okay, so when a traveler is coming to India, what will happen? He will be having something outside, right? बाहर कुछ भी खाएगा, what will happen? The bacteria will go inside and it will be causing diarrhea in that in that particular patient, right? So this is known as traveler's diarrhea. Okay. Next we are having enterohemorrhagic. It will be causing hemorrhagic colitis. So that would be having problem with the blood, right? And lastly we are having enteroaggregative, that would be causing persistent type of diarrhea. Persistent type of diarrhea. I have already told you, for example, there is a person who is having UTI. What is the test that we will be doing? We will be doing the culture, and for that culture, we are putting the like sample onto the clad. Okay, onto the clad. And how do we take, like, if I want to take a sample from the urine, how I will take the sample? That I will be taking from midstream urine. Midstream urine. Okay, midstream urine sample I would be taking from the midstream urine. Okay, these are the important points that you have to remember. Try to solve this one. Hemolytic uremic syndrome is associated with hemolytic uremic syndrome is associated with HUS is associated with which type of E. coli? That is E. coli O157H7. Okay, O157H7. That is the thing that you have to remember. This enterohemorrhagic is also associated with O157H7. Okay, so this is the question they have asked you. Clear? Now try to solve this one. A 40-year-old man presented to OPD with high fever. Patient को क्या क्या complaints है? Patient is having high fever. Patient is having constipation from last 3 weeks. Patient is having constipation from last 3 weeks. He has already had some drugs and now he is having what kind of diarrhea? Pea soup diarrhea. Pea soup diarrhea. On examination, he is having relative bradycardia. Can anyone tell me what is this sign known as? And hepatosplenomegaly is also noted. Which of the following is the best test for diagnosis? First of all, please try to tell me what is your diagnosis. What do you think this thing can be? Try to answer, guys. What is your diagnosis? What is your diagnosis? क्या हो रहा है इस पेशेंट को? What is the thing that is happening to this particular patient? Try to make the diagnosis. Where do you see pea soup diarrhea, guys? Pea soup diarrhea is a feature of pea soup diarrhea is a feature of which disease? C. Typhoid fever. So diagnosis is typhoid. Very good. Diagnosis is typhoid. But answer is not C. You will not be doing peripheral smears. 3 weeks. Remember, guys, Basu yaad hai? Basu. What is that? Basu, first week blood culture, second week agglutination, third week as for stool culture, and last fourth week is urine ELISA. Urine ELISA. It is not culture, guys. Don't in some notes it is misprinted. That is your urine ELISA. Okay, urine ELISA. So we can do 4 things. That is your Basu. Basu. Okay, so what you need to remember, this is your typhoid. What are the things you need to remember about typhoid? What would be the history? The patient is having something feco-oral route, something that is going via feco-oral route. Okay, feco-oral route से कुछ जाएगा. What is the type of pattern of fever that you will be finding? That is known as, कौन सा fever होता है इनमें? Try to answer. Till then, this particular sign is known as Faggot sign. Faggot sign, that is your relative blood bradycardia is known as Faggot sign. इसको क्या बोलते हैं? Faggot sign बोलते हैं. Okay, we will be looking for the titers. We will be looking for O antigen and H antigen. Okay, O antigen is your somatic antigen. H antigen is the antigen that is present in your flagella. Okay, this is your flagellar antigen. Okay, apart from that, the type of fever you will be finding is known as step ladder pattern of fever. In typhoid, what is happening? Step ladder pattern of fever. For example, first day is fever, next day the fever will be more, in the next day the fever will be again more. Okay, so that is working like a step ladder. So this is your step ladder pattern of fever. Okay, you will be finding some spots on the body. These are known as rose spots. इनको क्या बोलते हैं? Rose spots. These are known as rose spots. Okay, pea soup diarrhea we have already seen. Okay, so these are the important liners that you have to remember. Okay, what is the enrichment media that you will be using here? We have already discussed the enrichment media. What is the enrichment media? If they ask you question based on this, what is the enrichment media? What is the selective media? Try to answer, guys. Selective media. And what would be the transport media? Transport media क्या होगा? Transport media. We are talking about which bacteria? We are talking about salmonella. Salmonella, the enrichment media will be, bolo, that would be selenite F pro. That is for the Shigella and salmonella. Remember, Shigella and salmonella always together. Okay, always together. But this salmonella, ये जो होती है ये धोखेबाज होती है. What it has done, शिगेला और साल्मोनेला हमेशा साथ में रहते हैं, दो बहनें. बट दिस साल्मोनेला, व्हाट शी हैज़ डन, इसने विल्सन के साथ में चक्कर चला लिया. राइट, सो इट इज विल्सन एंड ब्लेयर. ओके, सेलेक्टिव मीडिया विल बी विल्सन एंड ब्लेयर. ये शिगेला के लिए नहीं होगा, इट विल बी ओनली एंड ओनली फॉर साल्मोनेला. ओके, एंड विल्सन एंड ब्लेयर के साथ चक्कर चला के इसने क्या किया? मुंह काला कर लिया. दैट इज वाई इट विल बी गिविंग विच कॉलोनीज? jet black colonies. Jet black colonies. Okay, jet black colonies. What is the transport media? Shigella, salmonella, the transport media will be sex media. Sex media. Sex media. Okay, so these are the important things about Shigella and salmonella. समझ में आया? Right, so answer here will be, they are talking about past 3 weeks. So what we can do after 3 weeks, which test can come positive? That is your best test that we can do is, they are asking about the best one. The best one will be, again, the best one will be Vidal. We can do here, right? Vidal is basically antigen testing, right? Vidal is basically the antigen testing, right? So we can do it here, right? So this is done and dusted, right? Try to solve this one. A patient presented with abdominal pain. Patient is having pain. Patient is also having some kind of diarrhea. Step ladder pattern of fever again. He is also having complaints of headache and malaise. His symptoms are gradually worsened over the past 2 weeks. Which of the following is the best diagnostic test? Answer this one. What is the best test that you will be using here? It's not culture, it's ELISA. What is the best test that you will be using over here? That would be again your Vidal test, guys. Again your Vidal test. Okay, what will happen in typhoid? Basically your intestine will be having some kind of perforations. Okay, so that is why those people who are having typhoid, they are not able to eat things that normal people are eating. Okay, उनको क्या बोलते हैं? दलिया खाओ, खिचड़ी खाओ. Okay, lot because the intestine are having some kind of perforations. Okay, so that is because of salmonella typhi. Salmonella typhi. Okay, 1 महीने तक कुछ नहीं खाना. ठीक है, we are using ciprofloxacin, and we can also use ampicillin also. The drugs are different. Okay, treatment we are not discussing here, right? So a 45-year-old man with multiple sexual partners present with a palmoplantar rash. Okay, on examination, mucocutaneous papules on the scrotum and lymphadenopathy are observed. Which of the following is the likely diagnosis? Try to answer this one. What you can see here, try to answer what is your diagnosis first. Is it a psoriasis? You can solve questions in two ways. Either you can eliminate the option, either you can directly you just have all the clues that is directly directing you toward the direct option, right? So that is your, if you know the all the clues are going towards the single answer, then you can mark, otherwise try to rule out the option most of the times. Okay, so look here, what is this thing is happening, this is the rash that would be present in primary syphilis, secondary syphilis, tertiary syphilis, or psoriasis. Psoriasis, remember guys, we have studied psoriasis and dermatology. That would be your psoriasis will be present on which surface? Extensor surface. Okay, it will be having which kind of scales? It will be having silvery white scales. Silvery white scales will be there. Okay, so we cannot think in term of psoriasis over here. It is not psoriasis, so psoriasis is already ruled out, right? In primary syphilis, what will happen? There will be a painless ulcer. We have seen in a question that is painless ulcer, and we call it chancre. Primary syphilis, there is a painless ulcer, and we call it chancre. Okay, so that is your chancre. Secondary syphilis, you will be having a thing that is known as condyloma lata. Condyloma lata. Remember lata ko syphilis ho gaya tha, right? So that is your condyloma lata. You are appreciating here. These are the rashes present on your palms and soles. Apart from that, these patients will be having in secondary syphilis, what would be another manifestation? You will be having moth-eaten alopecia. Moth-eaten alopecia, right? In tertiary syphilis, what you will be finding, you will be having, tertiary means what is happening, it is a long time. Primary syphilis, then secondary syphilis, then there will be early latent, that is up to 5 years, then there will be late latent syphilis, that would be 5 to 15 years. Okay, and then there will be tertiary syphilis, so that is a long term condition, and you will be having granulomas, and these granulomas are known as specifically gammas will be there, right? You must have seen the images of gammas. There will be some kind of image with the pus, you have seen it, right? So that is your tertiary syphilis. Okay, tertiary syphilis. Okay, try to solve this one. So answer here will be secondary syphilis. These are condyloma lata. Okay, condyloma acuminata, you will be finding genital warts. Okay, condyloma acuminata kya hota hai? That is your genital warts. Here we are talking in the terms of condyloma lata. Okay, next we have to see, next question is, a 22-year-old patient presented with high grade fever. Symptoms kya hai? The first symptom is high grade fever. The patient is confused and having purpuric rash. Okay, as shown in the image below, CSF sample is showing gram-negative diplococci. Gram-negative diplococci, which of the following is most likely the etiology? Okay, what can be the etiology over here? Gram negative. Okay, gram negative, they are talking in terms of gram negative, so your answer will be, first thing you will be ruling out will be streptococcus. That is a gram positive bacteria, right? Streptococcus is a gram positive bacteria, so we will be ruling out it. Okay, apart from that, from these three, what can be the answer? What can be the answer, guys? Which thing will be having rash? These are the symptoms you will be finding. CSF, if they are taking the CSF, that means the patient is having symptoms of meningitis, right? Meningitis. Okay, and this meningitis can be due to Neisseria. This meningitis can be due to Neisseria. That is your Neisseria meningitidis. Okay, that is your Neisseria meningitidis. I will be explaining you this question also after this question. Okay, look here. An 18-year-old female present with a severe headache. The patient is having severe headache, high fever, 101. Okay, on examination you are having papilledema. Okay, nuchal rigidity was present. The organisms lacks plasmid, and gram staining of the CSF is shown below. Okay, so again we are having CSF. Okay, again we are having CSF, and what they want to know, the organism do not have plasmid. Okay, organism do not have plasmid. So what is the organism? Can you appreciate how you can identify? Try to see here, guys. We are having gram positive bacteria, gram negative bacteria. Gram positive, gram negative. Let gram positive will be giving which color? Purple or violet. You must have seen the gram staining, that is your methyl gas. Ultimately what you are getting, that is your, because of safranin you will be getting what? Safranin will be giving you which color? Okay, that is your gram positive and gram negative bacteria. So gram positive will be giving you which color? Purple or violet color. Gram negative bacteria will be giving you which color? That would be your pink color, right? They will be pink in color. So can you see this is a gram positive bacteria or is it a gram negative bacteria? It is a gram negative bacteria. Okay, so first thing you will be ruling out is your streptococcus pneumonia. Okay, streptococcus pneumonia को बाहर निकाल देंगे. Plus second thing you can rule out is listeria also. Listeria, why? Because we already know listeria will be present in the form of bacilli. Here there is no bacilli, there will be some kind of other things. Okay, so you can rule it out. Okay, hemophilus influenza, I have told you we will be looking at it generally in the chocolate agar. Okay, so your answer can be here Neisseria meningitis. Okay, let's see how we will reach the answer. Okay, these are the two things we have to remember. These are your gram negative cocci. Okay, first thing, pink color, that means it is a gram negative bacteria. Second thing, they are present in the form of round structure, that means it is a cocci. Okay, so it will be gram negative cocci, and two things only we have to remember about it. We are having four or five, but you have to remember two, that is your meningitis and second one is your gonorrhea. Okay, meningitis and gonorrhea, what are the important points that you have to remember? Both of them are diplococci. Okay, this is your meningitis. First thing, what is that agar that we are using? That is your Thayer Martin media. Thayer Martin media, we can use it for both. Okay, second thing, on blood agar it will be showing gamma hemolysis. Again, gamma hemolysis will be partial hemolysis. Okay, virulence factor will be ciplo will be the virulence factor. What are the special feature that you need to remember? That is, it is a lens shaped bacteria. Second thing, it can ferment glucose and maltose. इसके नाम में ही लिखा है, that is meningitis. It will be having G, it will be having M, so it can ferment both glucose and maltose. Okay, next thing important is plasmid is absent. What is plasmid? What is plasmid बच्चों? Try to answer what is plasmid. So plasmid is extracircular piece of DNA, right? It is extracircular DNA that would be helping the bacteria to gain the resistance. Okay, so if the plasmid is absent, what is happening? This bacteria is resistant, non-resistant bacteria. Okay, this is your meningococcal meningitis, the disease that it will be causing, and the patient will be having what? Rash. These patients will be having rash on the skin also. Okay, what are the complications? Two complications they have asked questions. First one, the complication of meningitis will be Waterhouse Friderichsen syndrome. Second one is your bilateral adrenal hemorrhagic necrosis. Okay, these are the two most important complications that you have to remember in terms of these two bacteria. Okay, ये तुम लोगों को याद रखनी है दो. ठीक है, apart from that we are having this particular thing, that is ड्रग ऑफ चॉइस. इट इज द ड्रग ऑफ चॉइस विल बी सिप्रोफ्लोक्सासिन. ये क्वेश्चन आता था पहले, अभी कुछ टाइम से आ नहीं रहे. फॉर कैरियर वी आर गिविंग सिप्रोफ्लोक्सासिन एंड सेफ्ट्राइक्सोन. इफ सपोज इफ द कैरियर इज कमिंग टू हॉस्पिटल, ओके, इफ द कैरियर इज कमिंग टू हॉस्पिटल, देन आई कैन गिव IV ड्रग, that is your ceftriaxone. Otherwise, for mass prophylaxis, what I can give? Mass prophylaxis, I can give ciprofloxacin. Okay, ciprofloxacin. Cases, if the case is identified, then the drug of choice will be penicillin. Otherwise, I can use ceftriaxone as well. Okay, I can use penicillin and ceftriaxone as well. Next is your gonorrhea. Gonorrhea will be causing, gonococci will be causing gonorrhea. Okay, again the culture media will be Thayer Martin. Apart from Thayer Martin, one more media is there, that is your Newark agar. Newark agar, यहाँ पर दो याद रखने. यहाँ सिर्फ Thayer Martin था, यहाँ we are having Thayer Martin plus Newark agar. Okay, virulence factor will be same. This bacteria will be kidney shaped. Okay, gonorrhea, just look here, it is looking like kidney. Okay, it is looking like kidney, so gonorrhea will be kidney shaped or bean shaped. Okay, it is a diplococci, non-capsulated bacteria, and this one will be fermenting only and only glucose. क्यों glucose? Because it will be having G in the name itself, right? सिर्फ G है, so that would be fermenting glucose only. In males, it will be causing acute urethritis. Can you see this type of discharge which is coming? That is your acute urethritis. Which kit you will be using from your STD kits? Okay, which kit you will be using for this one? Second, in females, it will be causing cervicitis. Third, in neonates, what will happen? If the mother is having infection, the baby can have ophthalmia neonatorum, that is infection of the eye. Okay, two complication here also we have to remember. One is water can perineum. There was Waterhouse Friderichsen syndrome. Here is Waterhouse Friderichsen syndrome, here water can perineum. Okay, second one is your Fitzhugh Curtis syndrome, which is basically perihepatitis adhesions will be there. Okay, so that is your perihepatitis. How you will diagnose? You will be taking swabs from the particular area. Okay, and drug of choice will be ceftriaxone or azithromycin that we are using here, right? So this is about the two bacteria that we have already discussed. Okay, now try to answer this one. A militant present with fever and rash all over his body, okay, which started in the trunk first. On examination, a rash was all over the body, sparing the palm and soles. Along along with the lice was noted. Okay, which of the following is responsible for the condition of this particular patient? Okay, try to answer this one. So these are the question they are asking. इस वाले का आंसर करो. Is it Taifi? Is it Prowazaki? Is it Akari? Is it Konori? Okay, how you will differentiate? How you will remember? Okay, how you will remember? We are having this thing. We are having this thing, guys. This is the important one. You know what is happening? People are studying microbiology. Like, for example, someone is studying about bacteriology. They will be studying the bacteriology from the front part, but they are asking question from the back part. Okay, because they already know the mind is already exhausted till the time we are reaching to this infections. Okay, these are your mycoplasma, rickettsia, chlamydia, spirochetes infection. Till the time what is happening, you will be exhausted. Okay, and they are asking question from these things. Okay, coxella burnetii and bartonella, legionella, all these things they are asking question nowadays. Okay, so how to remember? Just remember it like I said. Just remember louse, flea, tick tick, mite. Just remember like louse, flea, tick tick, might. In this sequence, if you remember, you can be remembered, it can be remembered. Okay, so epidemic typhus will be via Prowazaki. So you can remember the mnemonic EPL. Okay, epidemic will be Prowazaki, and it is a louse bone disease. Okay, so we are having what in the question itself, they have given the lice. So your answer will be Prowazaki. Your answer will be Prowazaki. Okay, your answer will be Prowazaki. Endemic typhus will be typhi, and it is due to a flea. It is due to a flea. Rocky Mountain, just remember R for Rocky Mountain, R for Rickettsy, R for Rocky Mountain, R for Rickettsy. India is in the Kona. In the map, you can remember map के अंदर इंडिया कोने में है. So India will be in the Conori. Okay, बॉक्स विल बी हैविंग सम काइंड ऑफ शेप, सो यू कैन रिमेंबर उसका कुछ आकार होता है, तो दैट वुड बी आकारी. ओके, एंड स्क्रब टाइफस, दैट इज वेरी इजी, दैट इज ऑरेंशिया सुशुगामुशी. ओके, ऑरेंशिया सुशुगामुशी. ओके, so these are the ones you have to remember. Again, revise with me. We are having louse, flea, tick, tick, mite. Louse, flea, tick, tick, mite. Again, started it off with the EPL. Epidemic पहले रखेंगे, and that would be P for Prowazaki. Okay. T for typhus. The second one is your typhi, and third Rocky Mountain will be Rickettsy. R for R. India will be in the Kona. Pox will be in the Akar. Pox का कुछ shape होता है. Pox virus that would be having Akari, and scrub typhus will be Orentia shushugamushi. Okay, okay, Orentia shushugamushi. हो गया ना? Repeat again. You can watch it again. Okay, you can remember. So this one is the, ये दो याद हो गए तो सारे याद हो जाएंगे. ठीक है, दिस इज हाउ यू कैन रिमेंबर. अदर सिम्टम्स विल बी ऑलमोस्ट सेम. पेशेंट विल बी हैविंग fever, patient will be having rash. Okay, so you have to identify the organism. Tick, is it a tick? Is it a flea? Is it a louse? Is it a mite? Okay, so this is how you will be remembering. Okay, try to answer this one. A patient was diagnosed with, अगर अब भी नहीं आ रहा तो पूछ लो. Okay, next one. A patient was diagnosed with TB. While testing for resistance, he was found to be resistant to isoniazid, rifampicin, amikacin, and levofloxacin. What is this type of TB is known as? What is this type of TB is known as, बच्चों? बोलो बेटा. What is this type of TB is known as? Is it a isoniazid resistant TB? Is it a multi-drug resistant TB? Is it a extensively drug resistant TB? Is it a rifampicin resistant TB? So multiple drugs are already given. These two options are already gone, right? These two options are already gone because isoniazid cannot be the answer. Rifampicin cannot be the answer. The answer here will be, it is a XDR TB. It is extensively drug resistant TB. What is MDR TB? It will be resistant to rifampicin and isoniazid. Okay, XDR will be what? XDR will be, it will be resistant to rifampicin, it will be resistant to isoniazid plus injectable, any injectable. Here we are having amikacin, which is a amino glycoside, okay, and any fluoroquinolones, that is your levofloxacin. Okay, so it is resistant to these four things, that is known as XDR-TB. What is TDR-TB? Total drug resistant, that means nothing is working. In that case, we are having new drugs now. We are having bedaquiline, we are having pretominide. So these are the things we are using nowadays. Okay, so that is for the total drug resistant TB, MDR and XDR-TB. Okay, clear? TB is due to which bacteria? That is due to Mycobacterium TB. Okay, so most important points about TB I have gathered here. It is the obligate aerobe. That means TB bacteria will be found in the upper part, upper lobes. Okay, upper lobes of the lung, because it will be having good amount of oxygenation. Okay, second thing, it is 20%. It is 20% acid fast. It is how much acid fast? It is 20% acid fast. Okay, next thing, we are having lab diagnosis. What is 5% acid fast? 5% acid fast कौन सा होता है? Next one is your sputum. How we can do the sputum? Suppose patient is coming to you for like diagnosis. What the patient will say, sir, I am having cough for like more than 15 days. So what you will do, you will be sending the patient for, you will be sending, is it fine? Volume is fine now? I think it's fine now. Is it fine now? Okay. Is it fine? Okay, so we are having sputum. So what we can do, we will be putting the sputum. जैसे ही patient अपने पास में आएगा बच्चों, क्या होगा? Patient आएगा, बोलेगा sir I am having TB for like more than 15 days. Okay, now what we will do, I will be taking the sputum. अब उस sputum का क्या कर सकते हैं? We can do two things. I can put that sputum for Zn staining. Zn staining, what will happen? You will be having these type of bacteria. Okay, Zn staining में आप हीटिंग करोगे, 20% H2SO4 डालोगे, अल्टीमेटली मिथाइलिन ब्लू डालोगे, दैट वुड बी हैविंग योर कार्बोल फ्यूशन डाइन की वजह से कौन सा कलर आएगा? दैट वुड बी गिविंग यू रेड कलर बेसिलाई. ओके, सो दीज आर योर रेड कलर बेसिलाई एंड दिस इज द बैकग्राउंड विल बी blue because of methylene, right? So what will happen? This is your Zn staining. Apart from that, what you can do, you can culture the bacteria in which medium? That is your LJ media, Lowenstein-Jensen media, guys. Lowenstein-Jensen media, you will be having eugonic growth, luxuriant growth, and the colonies will be rough, tough and buff colonies. This type of explanation, if they are giving you in the question, please go for Lowenstein-Jensen media. And can anyone tell me, for LJ media and LSS, what is the method we are using for sterilization? Anyone, please try to tell me, guys. बोलो बच्चों. Okay, next what we can do, we are having CB0. We can do CB0 for which gene? It can be telling us about the RPOB gene. That would be telling me about the rifampicin resistant. That would be telling me about the rifampicin resistant. Apart from that, we are having gene expert. We can do gene expert. That is basically a type of polymerase chain reaction, and we are doing it for which gene? That is IS6110 gene. Okay, that is very very important. These are the important markers that you have to remember. Okay, for IGRA, guys, for IGRA, that is CFP10, or we can also use ESET6. Okay, we can use CFP10 or ESET6. Okay, it is basically interferon gamma release assay. Okay, basically what is happening, whenever bacteria will come, इसके चारों तरफ क्या होगा? interferon gamma एक layer बना देगा. What will happen whenever it will release? What will happen? This will come into blood. Okay, so we can check for that. Okay, we can also do line probe assay. LPA is line probe assay to identify the resistance. It is a MDR-TB or XDR-TB. We can easily identify with the help of LPA. Okay, next method we are having, that is your fluorescent method that we have already discussed. हम लोग क्या करेंगे? जो sample लिया है, for example, I am taking the sample in the tube. उस ट्यूब को I will be passing under fluorescent light. Okay, what will happen if there is TB bacilli? If there is TB bacilli, that tube is already lined with what? Auramine rhodamine, which is a dye. Okay, उसी के अंदर sample लिया. If there is bacteria, what will happen? The bacteria will shine out. The bacteria will shine out, and I will send that particular patient for sputum examination, further sputum examination, or further gene expert I can do. Okay, further investigation. Okay, confirmation के लिए आगे भेज देंगे, right? Next one is your tuberculin test. Tuberculin test, we are using 0.1 ml of PPD on the flexar aspect of the we are using tuberculin or Montex test. Okay, so that is your mycobacterium. That is your mycobacterium. कौन से का B? This one. This cannot be multi-drug resistant TB. This cannot be multi-drug. That is resistant. Okay, options में गलती है. That is resistant. Okay. Next one. A veterinarian developed an ulcer with a central black scar over the forearm. Okay, as shown in the image. Which of the following is the most probable causative organism? Try to answer. Try to answer this one. There is black scar on the forearm. Okay, there is black scar on the forearm. This is a disease that is known as Bacillus anthracis case. Bacillus anthracis spores. It is a disease which will be showing which kind of reaction? These are capsulated organisms. Okay, two organisms which are capsulated. Two reactions we have studied. One is for the pneumococcus, that is Q-lung reaction, and second one is for the Bacillus anthracis, that is your McFadden reaction. The capsule of this particular thing is made up of polypeptide. All other capsules are made up of polysaccharides. Okay, this one tolerances cannot be the answer, sir. This will be causing tularemia. Okay, bachcho. Yersinia pestis will be causing what? Yersinia pestis will be causing plaque. This is not the presentation of plaque. And Pseudomonas, we will be discussing about that. That will be generally seen in burn patient. It will be giving, it will be having pyocyanin, okay, pyoverdin. So that would be giving you, definitely that would be giving you different colors. Okay, now please try to see. This is your Bacillus anthracis. This is your Bacillus anthracis. Bacillus anthracis, what are the important things that you have to remember? The capsule will be polypeptide. The capsule will be polypeptide. The reaction will be McFadden reaction. Okay, its spores can be utilized as a bioterrorist weapon. Okay, what is the appearance that you have to remember? This is known as Miss Bamboo appearance. Okay, Miss Bamboo appearance, what you have to remember, just think like that. There is a madam who is standing nearby you. There is a miss. She is having Medusa head appearance. She is having inverted fir tree appearance. Okay, you can appreciate this is your inverted fir tree appearance. S4, there is some kind of string of pearl appearance. तो ऐसे समझो, there is a lady who is standing. उसके अंदर तीन चीजें हैं. First one is your Medusa head appearance है. I4 inverted fir tree appearance है. S4, she has worn the string of pearl. उसने माला पहन रखी है, string of pearl. Okay, and she is having bamboo stick appearance. That means she is having a bamboo stick in her hand. Okay, what is the toxin we are having? Toxin, that is your tripartite toxin. Okay, and what is the culture media that we are using? That is your plate है ना. Culture media we have already studied, that is your plate. तो ऐसे याद रख लो, there is a madam who is standing. मैडम के अंदर क्या क्या याद रखना है? Miss Bamboo. Okay, Miss Bamboo means M for Medusa head appearance. Her appearance is Medusa head. I for inverted fir tree. She has worn something like that. Okay, S for string of pearl. She is having string of pearl. In one hand there is a bamboo stick. On another hand she is having a plate. Okay, and in that plate, what is there? In that plate we are having a toxin, that is tripartite toxin. कैसा टॉक्सिन है उस प्लेट के अंदर? ट्राईपैराटाइट टॉक्सिन है. ठीक है, उस प्लेट के अंदर टॉक्सिन है ट्राईपैराटाइट का मतलब होता है EPL टॉक्सिन होता है. एडिमा, प्रोटेक्टिव फैक्टर, लीथल फैक्टर्स आर देयर. ओके, सो दिस इज द स्टोरी ऑफ Bacillus anthracis. ओके, डिजीजेस की वजह से कौन सी होती है? डिजीजेस इज फर्स्ट वन इज योर हाइड पोर्टर्स डिजीज. जो लोग उठा के लाते थे डेड एनिमल्स को. बिकॉज ऑफ दैट व्हाट विल हैपन, देयर इज अपीयरेंस ऑफ दिस ब्लैक कलर स्कार दैट इज नॉन एज मैलिग्नेंट पस्ट्यूल. सेकेंड वन, वुल सोर्टर्स, जो लोग वुल को सोट करते हैं उनमें होता है पल्मोनरी एंथ्रेक्स. एंड देयर इज अ वन थिंग दैट यू कैन डू दैट इज नॉन एज, क्या कर सकते हो आप लोग, you can add formalin. Okay, formalin अपन दे सकते हैं to kill those spores, and this is known as duckering. Okay, to prevent wool sorters disease. Okay, next we are having is intestinal anthrax. Those people who are eating raw meat, okay, wild meat ingestion, what will happen, you will be having intestinal anthrax. Okay, and the test we can do is S. coli thermoprecipitation test, and test का नाम क्या है, S. coli thermoprecipitation test. Next is your Bacillus cereus, Bacillus anthracis, we have already studied, right? This is your bamboo stick appearance. This is your bamboo stick appearance. Okay, this is your inverted fir tree appearance. And whenever they will tell you in the question, they will give you malignant pustule, black scar. Okay, all these appearances. Okay, your answer will be in the terms of Bacillus anthracis. Okay, Bacillus cereus will be having two strains. One is emetic one, another one is diarrheal one. Emetic one will be having incubation period that is 1 to 6 hours, and that would be resembling the incubation period of one more thing, that is your Staph aureus. Staph aureus का भी रिजेंबल करेगा इंक्यूबेशन पीरियड. स्टैफ ओरियस में यू विल बी हैविंग मिल्क प्रोडक्ट, यू विल बी हैविंग पेस्ट्रीज. ओके, वो वैसे सिम्टम्स, वैसी हिस्ट्री मिलेगी. हियर यू विल बी हैविंग अ हिस्ट्री ऑफ Chinese fried rice. It will be increasing your cyclic AMP. Second strain is your diarrheal strain. Incubation period will be 8 to 16 hours. It will be having meat products. It will be having milk products. Okay, and it will be increasing what, cyclic GMP. Okay, try to solve this one. A 4-year-old boy present with complaints of fever and sore throat. On examination, he has extensive cervical swelling and a well-demarcated white-gray exudative substance adherent to this oropharynx. And when he tries to remove this membrane, basically it is a pseudomembrane. When he tries to remove, what will happen? There will be bleeding, right? The parent report that all his childhood vaccines were skipped due to religious belief, though a throat swab was done under Albert staining, and it was the image that is coming below, right? What is your answer? Your answer will be, try to answer guys, your answer will be, yes, that is your B, that is your diphtheria guys. Diphtheria is the answer here. Tetanus is caused by Clostridium tetani. Pertussis is caused by Bordetella pertussis. Okay, streptococcal pharyngitis will be having totally a different picture. It will not be having any kind of pseudomembrane, right? It will not be having pseudomembrane. Only if sore throat is given, that would be your most common cause of sore throat will be streptococcus, right? That would be causing pharyngitis. That would be causing pharyngitis. Okay, try to solve this one. A 55-year-old female comes to the OPD department complaining of fever. The female is having fever, cough is there, muscle pain is there, headache is there. On taking the occupational history, you need to take the occupational history as well. What is happening? The patient is working in a centralized AC system. Okay, the doctor sent a sputum sample for culture sensitivity. The microbiologist used which thing, that is your buffer charcoal yeast extract. Okay, to culture the suspected organism. Which of the following is the most likely cause? Is it a brucellosis? Is it a mycoplasma? Is it a legionnaire disease? Is it a pneumococcus, guys? Try to answer. What is this? Brucellosis, you will be having fever. Remember guys, brucellosis will be causing fever, Malta fever, undulant fever. So you will be having fever, you will be having rash. Apart from that, he must be giving you hepatosplenomegaly. So this one is already ruled out, splenomegaly. So this one is already ruled out. Okay, so this one cannot be the answer. BCA, remember guys, BCA, this is what? BCA. Why I have given you all the culture medias together? Because this is very important. If you can spot this particular word, you can directly reach to the answer. Okay, so BCA is the culture media for what? That is your Legionnaire's disease. Very good guys. Those who are saying D, pneumococcus cannot be the answer guys. Mycoplasma and pneumococcus, both of them can cause pneumonia. What is the difference between these two? One is mycoplasma is causing what kind of pneumonia? That is the most common cause for walking pneumonia. Walking pneumonia, guys. Mycoplasma will be causing walking pneumonia, whereas pneumococcus will be causing which type of pneumonia? Lobar pneumonia, right? Pneumococcus, we have already seen, it is the most common cause of meningitis, it is the most common cause of pneumonia, right? It will be causing lobar pneumonia, and mycoplasma will be causing walking pneumonia. This pneumonia, walking pneumonia, the drug of choice will be azithromycin. In mycoplasma, we are using azithromycin because it does not have cell wall, right? So we cannot use cell wall synthesis inhibitor, any of them like penicillin, amoxicillin, we cannot use that, okay? So walking pneumonia, the patient will be having, what is walking pneumonia? The patient will be having, क्या होगा बच्चे को, पेशेंट को क्या होगा बच्चों? पेशेंट विल बी हैविंग लेस symptoms but more disease. For example, in COVID-19 what was happening, हमारे दोस्त है, कोई भी फ्रेंड है, what is happening, लंग्स में ऐसा लग नहीं रहा था कि कोई इन्फेक्शन है, बट व्हेन वी आर गोइंग फॉर HRCT स्कैन, what is the finding? 70% of the lungs are damaged, 80% of the lungs are damaged. Why? Because it will be causing walking pneumonia. Walking pneumonia, the patient will be walking, उसको पता नहीं है कितना डिजीज है. लोबर निमोनिया जो न्यूमोकोकस की वजह से होता है, दैट वुड बी हैविंग मोर सिम्टम्स, ओके? थोड़ा बहुत कफ होगा, थोड़ा बहुत डिस्निया होगा, द पेशेंट विल बी ऑन द हॉस्पिटल, ओके? उसमें 4-5-10% भी लंग्स खराब है तो भी पेशेंट क्या होगा? हॉस्पिटल में होगा. दिस इज हाउ वी विल डिफरेंशिएट, ओके? डन, ओके? Yes, that is atypical. Lobar pneumonia, also known as atypical pneumonia. Sorry, this one is known as typical, another one is known as atypical. This is your typical pneumonia, and walking pneumonia is atypical pneumonia. Okay, most common cause of meningitis, if they ask you, your answer will be pneumococcus, okay? If they ask you most common cause of meningitis in children, then your answer will be agalacti, that is your group B streptococci. Group B streptococci is the most common cause. Again, one more question, if they ask you most common cause of UTI, then your answer will be E. coli. If they ask you most common cause of UTI in gram positive cocci, gram positive bacteria, then your answer will be, try to answer in the comment section, guys. Try to answer. What is the most probable diagnosis for a farmer? Now let's discuss about some fungus questions, okay? So mycology, they are asking questions, a lot of questions they are asking. So what is the most probable diagnosis for a farmer who has a wart like skin growth on his foot, okay, as shown in the provided histological image? Can you see what is this? You already know this, I know you already know this, multiple times this question has been asked, but you don't know this, okay? So this is also what copper penny bodies, this is known as copper penny bodies. And what is the disease that I'm talking about over here? This is your copper penny body. This is also known as, another name for copper penny body will be medlar bodies, guys. Medlar's bodies, sclerotic body, muruliform body, okay? Medlar body, these names are important. Medlar body, sclerotic body, okay? Muruliform body. So these are the important names that you have to remember about this particular thing, okay? This disease is known as, what is the diagnosis? Diagnosis is chromoblastomycosis. Very good, everyone is answering chromoblastomycosis. Chromo means it will be having color, it is a color, it will be giving some kind of color. You will be having warty lesion. Kab hoga ye lesion? When there is a farmer who is having, the farmer will be having thorn pick. The farmer will be having a thorn pick. You will be having some kind of warty lesions, okay? How you will treat this particular situation? What would be the drug of choice, guys? For this particular thing, the drug of choice will be, try to answer. The drug of choice for chromoblastomycosis, your answer will be itraconazole. The drug of choice will be itraconazole. Itraconazole we are using. Itraconazole. Okay. Next one. What is the probable diagnosis for a farmer who has swollen foot and multiple sinuses? Okay, the patient is having swollen foot, the patient is having multiple sinuses, right? Now, how you will identify? First of all, try to diagnose the disease, and then we will be understanding the treatment, okay? इसको diagnose करो, then we will be discussing about the treatment. Here sporotrichosis cannot be the answer. Mycetoma I will be showing you now. Okay, mucormycosis cannot be the answer. Okay, look here. What is the probable diagnosis? Sporotrichosis, Vanshita, Dr. Kavita, mycetoma. Everyone is going in the favor of mycetoma, right? So this is a mycetoma. This is not squamous cell carcinoma. First of all, it is not squamous cell carcinoma. It is mycetoma. Second thing, it is not chromoblastomycosis, because you will not be able to see multiple sinuses in chromoblastomycosis. Okay, sporotrichosis, you will be finding lymphocutaneous spread. Okay, lympho means where lymph nodes are draining. Around that place they will be having cutaneous manifestations of this particular disease, which is a subcutaneous type of fungal infection, right? So what will happen here? Look here, we are having two types of mycetoma, bachcho. We are having two types of mycetoma. One is bacterial mycetoma, second one is fungal. Okay, so we are having actinomycetoma, we are having eumycetoma. कैसे याद रखोगे? एक्टिनो विल बी बैक्टीरियल, बिकॉज आफ्टर ए देर विल बी बी, सो इट विल बी ए बैक्टीरियल इन्फेक्शन. ई के बाद में क्या आता है? देर विल बी एफ, सो दैट वुड बी ए फंगल इन्फेक्शन. यूमाइसिटोमा विल बी ए फंगल इन्फेक्शन, मदुराई फुट, दैट इज, एंड एक्टिनोमाइसिटोमा विल बी अ बैक्टीरियल इन्फेक्शन. ट्रीटमेंट क्या करोगे? बैक्टीरिया है, यू विल बी गिविंग एंटीबायोटिक्स. But if it is a fungal mycetoma, there is nothing you can do much here. You need to amputate the organ. You need to amputate the organ. Okay, you need to amputate the organ. Yes, there will be multiple discharging sinuses, you can appreciate. Okay, so your answer here will be mycetoma, Madurala foot, Madurai foot. Okay, that is your mycetoma. Try to answer this one. What is the organism that can be identified when a man who has received a kidney transplant is on immunosuppressant medication, showing budding cells with pseudohyphae on biopsy? So what are the hint that you are having over here? We are having a patient with kidney transplant हुआ है, and patient is having immunosuppressant medication. What are those immunosuppressant medication? क्या हो सकता है? The patient can be on the steroids. Okay, patient can be on the steroids, right? Now the histopathology, the things that we are seeing on the biopsy, what we are finding budding cells are there, and we are also finding pseudohyphae. Budding cells and pseudohyphae are the feature of, very good, everyone is answering, that is A, that is invasive candidiasis. Let's discuss about candidiasis, guys. Look here. What is candidiasis? Try to solve this one also, then we will discuss about candidiasis. What is the probable diagnosis for a 35-year-old patient with HIV positive and exhibits mucosal lesions in the mouth? Okay, as depicted in the provided image, with the presence of budding yeast will be there, budding yeast. Okay, and pseudohyphae. This is the question they have asked you again. So is it diphtheria? Diphtheria will be having membrane, right? Diphtheria में हम लोगों ने membrane पढ़ी थी. What is that membrane? That is your pseudo membrane. When you try to remove that pseudo membrane, what will happen? Is it going to bleed or not? Yes sir, it is going to bleed. When we try to remove that pseudo membrane, it is going to bleed, right? So that is your pseudo membrane, and it is present near fascial pillars. This is how you will be differentiating. Here the thrush, this is known as oral thrush. यहाँ पर oral thrush होगा. When you try to remove, it will come out, right? So that is your oral thrush. Lichen planus, what is the thing that we have seen in lichen planus? Lichen planus, what was there on the tongue? On the mucosa, oral mucosa, you are finding lacy reticular pattern, right? Lacy reticular pattern. Okay, or you can also call it cobblestone mucosa. Cobblestone mucosa was the feature, right? Cobblestone mucosa was the feature that we have already seen. Okay, hairy leukoplakia, it is not a cancerous disease because we have seen the yeast, so it cannot be the answer. The answer will be oral candidiasis. Your answer will be oral candidiasis. Remember guys, candida, let me tell you important points about candida. In candida you will be finding some important points. These are your first thing. Whenever you see Raynaud-Broad phenomena, whenever you see Raynaud-Broad phenomena, which is basically nothing but the formation of the germ tube. Okay, so this is known as Raynaud Broad phenomena. Question के अंदर identify करने these keywords. When you identify these keywords, your answer will be directly right. So these are your germ tube, formation of germ tube, that is Raynaud's Broad phenomena. Second thing you have to remember is chlamydiospore, that is your chlamydiospores. These are the two important questions. Okay, chlamydiospores you will be finding on the corn meal agar. On which agar? Corn meal agar. Corn meal agar, chlamydiospore, your answer will be candida. Okay, one more question they have asked you is about the chrome agar. Chrome agar, they have given you the image and they have asked you about the species, that is candida having multiple species, like okay glabrata hai ki kaun sa hai, right? So chrome agar we will be using for candida infection, we will be using for candida, and this one will be colorful. Whenever you will see colorful image, that would be your chrome agar. Okay, apart from that you will be finding oral thrush. How you will culture this particular bacteria, this particular organism, that is your fungus, how you will culture? You will be culturing fungus on sabrode dextrose agar. Okay, you will be culturing them in sabrode dextrose agar, sabrode dextrose agar. And what kind of colony you will be finding? You will be finding a specific creamy pasty colony, creamy pasty colony. Okay, if you need to identify, for example, it is in the invasion, for example it is in the blood, invasive type of candida, you can do a test for invasive type of candida. You can do a test that is known as 1,3 beta glucan assay, 1,3 beta glucan assay, right? And the last thing, how you will treat this situation? You can treat it with the help of antifungal drug, that is fluconazole. Fluconazole, कौन सी दवाई दे सकते हो बच्चों? दैट इज योर फ्लूकोनाजोल, फ्लूकोनाजोल. वेरी गुड कविता, बेसला, ओके वंशिता, आंसर कर रहे हो तुम लोग. नाउ ट्राई टू सॉल्व दिस वन. Which dimorphic fungus listed below is responsible for causing subcutaneous mycosis? Try to answer this one. Which one will be causing subcutaneous mycosis? सबक्यूटेनियस माइकोसिस कौन सा होगा इनमें से? स्पोरोथ्रिक्स शैंकी, हिस्टोप्लाज्मा कैप्सुलेटम, पेनिसिलिनोसिस मार्नेफी, ब्लास्टोमाइकोसिस. क्या होगा? Try to rule out penicillinosis marnefi. You must have seen, you will be having the arrangement of the conidias. They are asking simple questions. So here they will be affecting the HIV positive patients. Okay, and they will be having brush border conidial appearance. Okay, brush border conidial appearance. They will be having brush border like that. They will be having brush border conidial appearance. That would be like a broomstick. Okay, that is your penicillinosis. Okay, next blastomycosis. Just remember, B is looking like 8, so it will be having figure of 8 appearance, figure of 8 appearance. Budding will be figure of 8 appearance. Okay, this is also known as North American disease. This is also known as Chicago disease, Chicago. This is also known as Gilchrist disease, Gilchrist disease. North American, Chicago disease, Gilchrist disease. Okay, histoplasma, you can remember high, histo का high याद रख लो. It is like a TB type of things will be there. Okay, so high. It is also known as Darling disease. It is also known as Darling disease, and this one will be found in caves. Okay, Ohio will be the location, so that is your Ohio. High, you can remember high Darling disease, that would be found in the caves. Okay, lastly we are having sporotrichosis, sporothrix is the causative agent for sporotrichosis. It is the causative agent for sporotrichosis, and sporotrichosis is the infection that would be having a lymphocutaneous, spread. Okay, ठीक है, समझ में आया? सबक्यूटेनियस कौन सा होगा इनमें से? All of them, the subcutaneous will be sporothrix chancre. Okay, Look here, sporothrix, the important points we need to discuss. Sporothrix is caused by the bacteria that caused by the organism, that is your sporothrix shanki. You will be finding asteroid body. कौन सी body मिलेंगी? You will be finding this asteroid body on history. You will be finding rose gardeners. You will be having a history of rose gardeners. Basically what is happening, those people, this is also known as valentine disease. This is also known as valentine disease. So around the valentine क्या होता है, जो लोग फूल तोड़ते हैं तो कांटा लग जाता है. That is why this disease is occurring, and the spread will be lymphocutaneous. Look here, this spread is lymphocutaneous around the drainage of lymph node, and cutaneous means skin is involved. This is a subcutaneous disease. Okay, what kind of it is a dimorphic fungi that would be present in mold and yeast, both the form. Mold will be seen in the cold temperature, that would be around 25 degree, and they will be present in the yeast form at 37 degree. Okay, what kind of sporulation you will be finding? You will be finding flower like sporulation, you can appreciate. Okay, and yeast will be having cigar shaped narrow based budding. Okay, narrow based budding you will also find in this histoplasma. Histoplasma will also show you narrow based budding. Okay, so this is about the sporotrichosis. And the treatment of choice, again here the drug of choice that we are using will be, drug क्या होगा, कुछ ड्रग क्या होगा यहाँ पर, that is your itraconazole. Drug is your itraconazole. Okay, next one, what is the probable microorganism causing the pruritic? First thing, pruritic hypopigmented macules. Macules means what? What is a macule? Try to answer. What is a macule? Macule is a flat lesion. Okay, macule is a flat lesion. And confluent patches. Patches are there over the chest in a 24-year-old female. The skin scraping and KOH preparation exhibit numerous yeast-like cells. Okay, and short branch filaments are there, resembling the appearance of a spaghetti and meatball appearance. Okay, depicted in the image. We don't have image, but try to answer. What is the cause? Is it a versicolor? Is it a pityriasis rosea? Is it a candida? Is it a trichophyton infection? What can be the infection over here? Try to answer this one. What can be the infection over here? Is it Tinea versicolor? Look here, guys. Malassezia furfur, Malassezia globosa. Okay, Malassezia furfur, Malassezia globosa. They will be causing a disease known as pityriasis versicolor. सिंपल मतलब समझो, पिटाइरियासिस का मतलब होता है बच्चे स्केलिंग. ओके, स्केलिंग इज अ सेकेंडरी चेंज. स्केलिंग विल बी देयर. एंड versicolor का मतलब होता है डिफरेंट कलर. Okay, you will be having different color, versicolor. Another one, again pityriasis matlab scaling, rosea matlab it will be giving you red color appearance, red color appearance. Okay, so versicolor you will be finding on the trunk. You will be having hypo and hyper pigmented patches. Okay, you will be having hypo and hyper pigmented patches. And what are the things you can do when you go for the things? What you will be finding? You will be finding spaghetti and meatball appearance. Apart from that, when you put on SDA, seborrheic dextrose agar, you will be having fried egg colonies, fried egg appearance. You will be having fried egg appearance. Okay, so that is the most common organism causing pityriasis versicolor, that is your Malassezia furfur and Malassezia globosa. Okay, trichophyton will be causing infection of all the skin appendages, like your nails, like your hairs, like your glands. Okay, pityriasis rosea will be giving you, it will be having what kind of scales? It will be having colorate of scales. We have seen in derma, colorate of scales will be there. It will be giving you, there will be first patch that is known as mother patch or herald patch. Then there will be some kind of patches developed with the help of in a pattern that is known as Christmas tree pattern. Okay, how we can treat? It is a fungal infection. How we can treat? We can give selenium sulfide, we can use azoles. Okay, candida we have already seen, so candida cannot be the answer. So answer here will be Malassezia, guys. Malassezia. Okay, colorate of scale, colorate of scales will be there. Okay, next one, After a traumatic event, a male patient present with lesion, your task is to determine the organism responsible for this particular condition. कौन सा organism होगा जो ये condition करवाएगा? Try to answer this one. Which of the following organism will be causing this thing? First thing, tell me what is Mycobacterium scroflocium will be causing. ये क्या करवाता है? ये करवाता है, क्या करवाता है ये? सर्वाइकल, it will be causing cervical lymphadenopathy, cervical lymphadenopathy, okay, in children. It is the most common cause for cervical lymphadenopathy in children. Okay, Madurella mycetomas, we have already seen that will be causing what? Mycetoma. Okay, pityriasis versicolor, just now we had seen it will be present on trunk, so answer definitely will be your Sporothrix shanky. Okay, that would be causing what? That would be causing sporotrichosis. That would be causing sporotrichosis. Okay, bachche. Now, please determine the dermatophyte by examining the macroconidia displayed on the picture, right? कैसे identify करोगे? How you will identify this particular thing? So we are having three things. We are having trichophyton that would be affecting all three things. Okay, skin, nails, and hairs. We are having microsporon that would be not affecting nails. Apart from that, it will be affecting your skin. It will be affecting your hairs. Okay, epidermophyton E के बाद में H आता है. So that would not be affecting your hairs. Apart from that, it will be affecting your nails. It will be affecting your skin, right? So these are the three things. Now we will be differentiating इनको. How we will be differentiating between them, इनको differentiate कैसे करना है? Okay, so we are having this macroconidia, this one is your macroconidia. So we are having trichophyton, we are having microsporon, we are having epidermophyton. So everyone is answering C. Let's see if it is C. So माइक्रोकोनिडिया और मैक्रोकोनिडिया क्या क्या होते हैं? जो बड़ा वाला होगा उसको बोलेंगे मैक्रोकोनिडिया. दीज स्मॉल स्ट्रक्चर, दीज आर नोन एज माइक्रोकोनिडिया. ओके, सो फर्स्ट ऑफ ऑल लेट्स टॉक अबाउट trichophyton. You will be having which type of macroconidia? That is your pencil shaped macroconidia. Okay, pencil shaped macroconidia, and microconidia will be numerous. You will be finding numerous microconidia. Can you appreciate multiple microconidias are there? So this is your trichophyton. This is your trichophyton. Second one is your microsporon. बच्चे microsporon में क्या होगा? You will be having what? Look here, microsporon, you will be having this spindle shaped spindle. Microsporon में S आता है. Just remember, it will be having what kind of macroconidia? It will be having spindle shaped macroconidia. It will be having spindle shaped macroconidia. Can you appreciate? And microconidia कितने होंगे यहाँ पर? माइक्रोकोनिडिया कितने होंगे यहाँ पर? यहाँ पर बहुत कम माइक्रोकोनिडियाज होंगे. कैन यू सी? लुक हियर, कैन यू सी? सिंगल माइक्रोकोनिडिया इज देयर. Can you see? Single microconidia is there. So you will be finding less microconidia. Okay, and third we are having is epidermophyton. Epidermophyton will be having what? Clubbed shaped.